Clap according to how beautiful she's looking today. Praise God. Welcome, man.
Good morning. Thank you very much, Redeemed Christian Church of God, Rose of Sharon Parish, for inviting us to this special women's conference. We really regard it as a privilege. But before I go on, I want to first and foremost appreciate the presence of Her Excellency, the wife of the Vice President of Nigeria, Mrs. Dolapo Sibajo. I am very honored to be in your presence this morning. God bless you so much for all that you do. I want to appreciate the senior pastor, Pastor Emeka Obiago. Thank you very much, sir. The president of the Women's Fellowship, Mrs. Gloria Nzego, and the chairperson of the conference, as well as the wonderful team that put this together, Mrs. Rosemary Fowler. God bless you so much, ma'am. I'm Dr. Adelokpo Esther, as has been said before, and I'm a primary care physician with Bridge Clinic. Thank you very much. So I will be discussing with us today about women's health. And because I have a short period of time, I will pick on some salient points today. Next slide. So there is a particular statement that's like in an advert that says, if I don't take care of them, who will? Yes, we will go back to that statement at the end of my talk today. There's so much focus on us, taking care of other people, taking care of the family, taking care of the business, taking care of, others, sometimes at the expense of our own health. We don't take out time to take care of ourselves. Or sometimes, even when we're suffering, there's a pain that you're feeling on one side of your body. You just ignore it. Other people are here. I need to do this, or I need to sacrifice myself. But thank God for the theme of this conference, about no longer being silent about what we are going through. It is time for us to speak up. It is time for us to take, our health in our hands today. For us as women, our health is not just, what we are today, but it starts from the care of the girl child. As a girl, right from childhood, right from when we are born with all the eggs that we are going to ever have. So that is amazing. You don't suddenly develop eggs when you're ready to have babies. So that goes to tell us that even from the talk that was given to us by the last presenter, that the care of that girl child, the care of the young girl or young lady is so vital and so important for what our health is going to be for the rest of our lives. From issues of female genital mutilation and its effects in later life, to weight gain, obesity, and its effect on even the menstrual cycle and the reproductive system, to issues of early vaccination. Do I vaccinate my girl child? Do I take this vaccine or not? To cervical cancer. I will just pause there and say some things briefly. It says, women often spend so much time helping others that we don't take time to, even take care of ourselves. I'll spend a little time and talk about vaccination against cervical cancer. We've talked about, as mothers, we need to ensure that our girls, we take care of them, we watch them and all that. But apart from the normal immunization that is given that usually ends by 1.5 years, there is also the HPV vaccine, which we can give to our girls, usually from 13 years of age. We can start immunizing our girls in a way that will help protect them from cervical cancer. That doesn't eliminate the need for us to do regular pap smears anyway, but at least it will ensure that before any possible exposure to the virus that causes HPV or that causes cervical cancer, our girls are well protected. Now, I will go on to very short questions because I don't want to take our time. It says, when should a woman start getting annual exams? So, a woman should start seeking comprehensive and preventive care all her entire life. We shouldn't wait until we're trying to conceive and say, I want to do hormonal check. I want to do scan or something. Why? Because quite a number of times, I've seen women that they're trying to get pregnant, or even around that time where they're trying to do assessments, and we find out that while checking her, she has breast cancer. So every other thing that she's trying to do goes on hold because she has to face that. But how different would her case have been if she had undergone regular, health checks before this time? It says, when do I start getting a mammogram? So, of course, you can start having mammograms. Usually we say from 21 years of age, especially in people that have a family history. So it doesn't matter that, oh, I don't feel anything, you should get regular mammograms. And in younger people, we can do what we call sonomammograms, where, there's the concern about X-ray and radiation because of the mammogram. You can do a sonomammogram. So it's a scan of the breast that is done. And if there's any lump or anything in there, it can be detected. We should also not forget our monthly breast exam. You should do it every month. Facing the mirror, checking the breast, all the quadrants, divide the breast into 4 quadrants, and then, press to see if there's any kind of seed, or thickness within the breast, any lumpiness. So if you feel anything, it's best you go see your doctor, and your doctor checks it. The doctor can check and say, oh, madam, you're fine. Or you do a sonomammogram and it says, okay, you're fine. It's better that way than to just leave it and say, it's not a big deal, or it's just a boil. If I take antibiotics, it will go away. Okay. Now, another question that comes up. So my slides are a bit slow. Another question that comes up, and I know is on a lot of people's minds, infertility. Who is at fault? I've been very passionate about this particular topic, especially regarding to women. When I saw a young woman walk into my office, her head bowed down, very beautiful lady, and I said, madam, what's the matter? And she says, they've been trying to get pregnant, she's married. Her husband said she should go and check herself. She must be the problem. And I said, okay, you are both trying to get pregnant, but why isn't he here? She looked down and dejected that, well, he says it's my fault. I'll have us know that concerning infertility, that 30% of the causes of infertility are from the woman's side. Another 30% are actually from the man's side. Now you have another 20, that is a combination of the two of them. So there is an issue on the man's side, there's an issue on the woman's side. And then you don't have the 10% that is, it is undefined. You really cannot pinpoint what the cause is. Now, what are the things that can lead to infertility or affect a woman's chances of conception, later in life? So, of course, we have things like problems of ovulation, which is the most common cause. So we have blocked fallopian tubes due to PID. PID is poorly treated vaginal infection. So when a woman has like an infection, she's having discharge, you just rush to the chemist, okay, they just put, okay, take this, take this. A lot of times these are not properly treated. And when it's not properly treated, it leaves downwards and goes upwards into the womb and can cause what we call PID. This PID can cause blockage of tubes. I have to let us know that this PID is a very, very common cause of infertility. And one thing about this is that once a woman has blockage of her tubes, she's going to need assisted conception to get pregnant. So please, please, and please, that small vaginal discharge, that infection that we're seeing, or what we commonly call toilet infection, please don't take it for granted. Please. I really implore us not to do that. Apart from that as well, apart from issues of, the blockage of the tube, sometimes even the womb itself. Yes, people feel, oh, once you have a fibroid, that means you can't get pregnant. No, it is a fibroid in the wrong location or within the middle of the womb that can cause issues with infertility. Now, another question that comes to our mind says, does any of the methods of birth control cause infertility? Now, birth control in and of itself will not make a woman infertile. It will not cause permanent infertility. It will only make it temporary for as long as the woman wants to hold off having a child. Except, of course, if we're talking about permanent methods like tubal ligation, where you the surgeon ties the tubes, or in a man, a vasectomy, or in a situation where the woman just removes the uterus. Those are permanent methods, obviously. But the normal birth control pills and that we know about, no, they cannot cause infertility. So please, I hear that a lot from our women, are reluctant to go on birth control because they feel that it will eventually lead to infertility. That is not true. Okay, so this last slide says, live your best life. It says all the way to early adolescence, the proper care of infections, to the health of the adults, from the childbearing years till menopause. The need to care for the health of a woman cannot be overemphasized. We talk of women's health, but actually it is the health of the girl child that is paramount. Because who we are today was born out of the seeds of the past. It is never too early to pay attention to our health as women. As we cannot give what we do not have. I say again, if you remember the slide that we talked about at the beginning of my presentation, where I talked about that advert that says, if I don't take care of them, who will? So it should be that if I don't take care of myself, who will take care of them? If I don't take care of my health, who is going to take care of, these children? So it's or the family, or my siblings, who is going to be there for them if I do not take care of myself? It is not a selfish thing. It is an important thing that we have to hold on to as women, that we need to take care of our health. In this day and age, there's so much information out there. And so in summary, so I've talked about breast examination, getting mammograms. I've talked about cervical cancer and prevention. So we talked about vaccines, and we've talked about doing regular screening. I've talked about infertility. Infertility is not a woman's fault. It is not a woman's fault. An example, not being able to ovulate. Did she create herself that way? No. So it is, as women, please let us have this at the back of our mind and not walk around with so much guilt and heaviness in our heart that, oh, it's my fault. I'm the one that caused it. I know that it's a societal thing, but you are hearing it from the doctor today that no, it is not your fault. Don't hang on to that. Before I quickly go, I just want to show us our beautiful clinic, Bridge Clinic. This is the medical center where I work as the primary care physician. Once again, I want to appreciate every one of us for being here today. God bless you so much.
Thank you very much, Dr. Esther Adelopo. What a very, very concise teaching session that you've given to us.